Hi, everyone. I'm thrilled to be here today for the XR and AI Healthcare sponsored by Magic Horizons for a number of reasons. First and foremost, because I'm here with Laura Kusumoto, who I befriended a few years ago at a conference we both attended and have since seen her at other conferences. And Laura brings with her to this conversation today about AI in healthcare a vast background, starting with, and I forgive me for reading a bit here, but she worked for Kaiser Permanente and led a team that was scanning for and assessing emerging and advanced information technologies for potential benefit in healthcare. Also for Walt Disney Parks and Resorts, where she was Director of Technology of Innovation Enablement, I got to say that correctly, where she promoted the innovation portfolio and championed the adoption of innovation best practices and emerging technologies. And oh, by the way, she also held in-person summit events where one of the topics happened to be AI. She also worked for Deloitte Digital as senior manager, where she worked on applications for AR for engagement, information, and augmented shopping, immersive VR for training, and computer imaging for marketing and 3D commerce. Then a company many of us have heard of, Meta, formerly known as Facebook, where she developed and led an XR Hub team to create business solutions using VR, AR, MR, and 3D metaverse technologies. And then most recently, she is the founder and principal consultant for IterationZero, where she helps organizations in healthcare, education, and technology harness emerging innovations to achieve transformative results. And oh, by the way, very pertinent to why we're here with my care friends today, Laura was caregiver for her mom for 15 years, who had dementia, and also for her dad. And with all of that, Laura, thanks so much for being here with me today.
Todd, thank you for the invitation. Thank you for that magnificent introduction. I'm really, really happy to be here. As you say, I was involved in caregiving for my mother and father over a period of years. And, sometimes there's no better way to learn than the face-to-face and the day-to-day and seeing what caregivers actually have to go through. And I know there's many frustrations with our healthcare system. There are not with the people necessarily, but with the system, right? And there's also supreme frustration with the technology gadgets that are supposed to support people and the problems that they have in daily life. And so for the caregivers, I want to say I'm with you, even though I'm also optimistic about some of the things that technology can do.
Absolutely. Thank you so much for sharing that. It provides excellent context for why we're here today talking about this and the broader audience. And I think this will resonate for everybody, everything we're talking about today, because the goal is, we want to provide insight to help caregivers. And that's why we're here talking about technology, because it affects all of them in some way. And often they don't know what way. And we're going to talk about a lot of that today. So why don't we start a little bit, if you can just give an overview. I mentioned in the introduction about looking back at your history with AI in the 80s and then also in the 90s and 2000s with XR technology. Can you talk at a high level about that? And then we'll dive into that.
Yeah, happy to do that. So at the beginning of my career, I was a software engineer. And one of the most exciting jobs I had was working for a startup company. It was one of the first startup companies that was funded by venture capital, startup software companies that was funded by venture capital in Silicon Valley. And we were one of those hot startups. We were on a tear. We were reported in the Wall Street Journal of all the things that we could do. And we were working with many major companies. But then there was a downturn in this technology industry. And it really failed to meet all the hype and the expectations. And that's how I learned about tech hype. But the question is, what industry was this company in the 80s? It was AI. AI had a huge hype cycle and then a bust in the 1980s. And there were others to come. That's how I learned the hard way about hype cycles. And speaking of hype cycles, virtual reality and virtual worlds and all of that have gone through several of those. And with each one, you develop new things, and some of them become integrated into the world of technology and more productive over time. And so in the early part of the 2000s, I spent 7 years working on virtual worlds for commercial uses, including training for military and for nurses. And so that is how I ended up going into later on Kaiser Permanente, was understanding kind of the training systems and emerging technology as a whole and beginning to understand how that fits into healthcare. But today, virtual worlds and virtual reality are becoming the interfaces for AI. So as part of what we're going to talk about today, we'll touch upon smart glasses as a way of bringing AI to people. And these more advanced VR technologies will do that also in the future.
Yeah, that's excellent. And it really leads into what are our goals today. I mentioned a bit earlier. So we're looking to you, the audience. We want to share, and Laura will be sharing a lot. One is how to take advantage of AI, as a powerful ally in health. And there's different ways that it's used. Also, what to be aware of, what to watch out for, and ways to protect privacy and safety. Very important. And that's what a lot of us think about when we think about AI, is privacy and safety. And then also to advocate for applications of AI to improve the patient's experience in health. And so, Laura, if you want to jump in, you can talk more about that, or if we want to walk into, and let's talk about the big opportunities where AI may make a difference where other tech has failed.
Yeah, I'll just add that there are a lot of applications for AI that are already helpful today. So taking advantage of that can start now. And I think there's actually so many things going on that it's hard to know where to start for some folks. So we'll talk a little bit about that. And you talk about the fear, we've all heard examples of AI running amok, giving incorrect answers, and so forth. And I think we'll talk about how to know when that's happening and how to protect yourself. But ultimately, caregivers are in the best position to be advocates for the use of this technology and the safe use of it, because you know what is actually needed, and you also know what actually works versus what doesn't pass muster. So I think that's where we're going to aim.
I love that. And I'll talk about what I talk about in general relative to caregiving and patient advocacy, as well as dovetailing what you just said, is trusting your instincts as a caregiver, as an advocate, as a patient. Trust your instincts, and you have a voice. Do not feel you do not have a voice. Ask questions, understand, which leads to the first point that we outlined here, which is how to provide a smoother patient-centric experience for healthcare. When you think of that, what comes to mind, and what would you say?
Yeah, this is one of the big opportunities. And I think in a bigger picture, there are a lot of problems with our healthcare system, right, as we alluded to. And one of them is that the experience that a patient has is not designed around them in general. It's designed around the ability of the healthcare system to give them what they need, which is similar, but not the same thing. So that your experience of that may be very fragmented, right? You have to call all these different providers. The drugstore is different from the hospital, is different from the clinic, is different from all these different things. Now, there's been a lot of work to try to unify those things with electronic health records and all that, but it's still fragmented. Have you ever seen a doctor talk to a dentist? Your mental health provider is different from so it's fragmented. And I think AI has the opportunity, because it can recognize patterns and put things together. There's an opportunity there to help glue these things together as a more smooth patient experience when you have an AI operating on your behalf. So that's one.
How do you reduce complexity in transitions and onboarding? So, like for insurance and hospitals, that's a big topic.
Yeah, it's a huge topic. And I think anybody that's done any recent transition of insurance or onboarding into new insurance, you know that something always goes wrong. Really, they always misspell something, they get a date wrong, they miss some numbers, and then it results in a bunch of phone calls to robotic consumer, service centers and all that sort of thing. Well, people are thinking about the ways to apply AI to reduce that complexity, meaning making all of these transactions go more correctly and smoothly, because it doesn't really take a lot to recognize that something has gone wrong and what the fix may be. These things happen millions of times a year, right? So there's a lot of data out there, and the data, what AI is often about, is applying data to these problems and overriding, the flawed procedure. So already there are, AI actually has been used in insurance for quite some time to handle a certain percentage of, the easy cases, password resets, that kind of thing. And I think that will only grow because the models are much more powerful now.
Yeah. And so in that, assisting rather than burning doctors is another topic that really has to be factored into this. And when you say assisting doctors, we're talking about charting or data management. How do we do that efficiently and provide them that resource?
Yeah, this is one of the areas that is really being activated now, not 100% successfully, but many people have already experienced going into your doctor's office and they ask you, is it okay if I record what you're saying on my phone? And it's not their personal phone. Usually it's their professional phone, and they have an AI that is recording what is said, and then will create a summary note of what happened. And what this does is it reduces the amount of time that they have to spend outside of the appointments uh, summarizing what happened. Now, they still have to read the summary and validate the summary because AI makes mistakes. But that's one area where they can be helped a great deal. Dr. Robert Wachter talks about how the electronic health record was supposed to solve a lot of these problems, but it hasn't, because doctors have to do so much manual data entry, manual typing, working after hours in order to create these notes and perfect these notes. And the natural language tools they've had available up to now have helped to a certain point. The current large language models that we have can help with the summaries and going beyond just transcribing what was said. That's just an example. There's many other ways that they can be assisted.
Yeah, that's a great example. And I've seen that when I take my mom in for various appointments and they ask, would you mind? Because they have to get permission to be able to do that, at least where we go. And you say yay or nay, and they do. But it does, I can say, it does help the physician pay more attention to the patient and the caregiver rather than having to focus on trying to write down what was done. So that's great. Which leads to how does this empower caregivers?
Yes.
Real important.
Yeah. I think the most important thing that will happen here, and we'll talk about this more, is that caregivers can consult with AI to find out a whole bunch of things. What does a diagnosis mean? If a diagnosis is given, what would a care plan be for a particular problem? Just kind of preparing for interactions with the medical system, and also creating plans and strategies for delivering, care to the person that they're helping, empowering them with knowledge that used to be searching on the internet and now comes to you in a very organized and digestible way. I also think the things we were just talking about streamlining the bureaucracy of onboarding and all that sort of thing should help. And I hope that things happen like there's a pattern that can be used when you are calling in as a caregiver and not the patient themselves. Right now, that's handled very poorly throughout our healthcare system. But I think, again, AI gives the system more ability to process more complex concepts, like this is a caregiver, not just the patient.
So then would that then lend itself to reducing the cost of care administration overall, and how does that translate to the patient, the caregiver, and so forth?
That's the great hope. And it may actually be the great hype, I fear. But the great hope, and the hype in the sense that a lot of money is being spent on AI, right? And there's a high expectations. And it kind of looks like they're going to be met this time around, but there probably will be some disappointments. That said, the opportunity to reduce the cost of care administration is huge by a combination of AI and automation, which is just making something repeatable. But AI can feed it, digest and feed the correct information to the automation, and then provide kind of human understandable results. And that right there can streamline care administration.
Yeah, that's fascinating. This is an excellent point. When we talk about it, the final topic that we have here under big opportunities for today, speeding up research and drug discovery. And you and I have talked offline about this, and I'd love to hear your thoughts about it, and I may chime in as well.
Yeah, so speeding up research and drug discovery, obviously that research is a way of acquiring data about how well things do and do not work. And AI can be an excellent assistant to researchers, both in helping to find prior research to build upon and also to sort of categorize that, but also to do the number crunching, interpretation of the results, finding patterns that might not be found just by manual labor alone. And then with drug discovery, there's some spatial reasoning involved in some of the drug discovery. And there's also areas that the AI has been able to help by just sort of having the goal, let's make a better drug to attack this particular protein. And the former AI and former algorithmic ways of doing this kind of fall apart because we don't know what the program is. And AI can look at millions and millions of pieces of data and say, well, this thing worked, this thing worked, this thing worked. What is the pattern between them? Even if, a human looking at it would not be able to tell. So I think that's just kind of the basic explanation of why AI could really is already speeding up drug discovery and research.
Yeah, absolutely. And I'll chime in here where there's an organization called Every Cure. If you go to everycure.org, founded by David Feigenbaum, who has become quite well known for he saved his own life. He's a trained scientist, and what he determined was we could use AI to better understand and identify drugs that have been out there for decades that can be repurposed to help with, I think there's an estimated 10,000 plus rare diseases. And so if they can use all the AI to take all the information to identify what can help, it's amazing, and it's working. So I encourage everybody always to go check out everycure.org. So let's jump to, we've talked about the healthcare industry, and let's talk a little bit more about how it's the fastest growing adopter of AI. Yeah. And I know you want to look at it, and there are multiple angles to look at it from. So why don't you lead the way?
Sure, of course. So when we think about healthcare as an industry, we do have to remember there's, of course, a lot of different components. But when we look at sort of healthcare providers, large systems, and hospitals, as an these are enterprise, big companies generally, they are setting the pace for enterprise AI adoption. So there's a report by Menlo Ventures in late 2025, and they noticed that whereas healthcare normally lags behind other industries in adopting new IT technologies, in this case, it's completely flipped on its head. So let's also note that this is a $4.9 trillion industry, right? It is 1/5 of the US economy. 1/5 of the US economy. But it accounts for only 12% of the software that's purchased in our economy. but it's now deploying AI at more than twice the rate of the general economy, of all the other industries, more than twice. So that tells you that those opportunities we talked about earlier, they're seeing those opportunities and pursuing them. Now, who are they? I think we split up the healthcare system, if you will, as having different stakeholders. A big one is the healthcare systems we just talked about. That's the hospitals, clinics, doctors, nurses, and their teams. All of them are being affected by AI. And so are the healthcare payers on the insurance side. There's an enormous amount of processing, right, that goes into healthcare insurance onboarding, as we discussed, premium management. They're very complex plans, the decision adjudication, and not just health insurance, but also long-term care, which I think affects this audience as well. And so when you go for your long-term care insurance, there are rules that are applied and so forth. All of these things will be helped by AI. And patients, huge stakeholders, right? Patients are going to, I think, be more empowered in this era than they have been since before we had doctors, really. So that's an interesting prospect that's coming up. And then and consumers, patients also are consumers, and being able to provide ourselves with care and well-being before we become patients is another huge component of this. So if we think about all of this, all those things that can be affected, and on the other hand, let's go back to our overall macroeconomic situation where there's rising demand and costs of healthcare. Healthcare insurance is going up every single year, anywhere from 4 to 10%. Regulations are changing, so fewer people are helped. The healthcare system in the last 15 years has been throwing more and more people at problems. And also the drugs are getting more expensive, the treatments are getting more expensive. So what we have is sort of a hockey stick of cost that's going up with nothing changing it. And I think that we're looking at all those components I just talked about. All of those things could benefit from streamlining, from application of AI. So I think, and it's both the direct application of AI, but also this consumer empowerment and patient empowerment may also help quite a lot. So we'll get into that a little bit more.
Yeah, it's fascinating. I mean, so much of this, it all resonates for me in different ways in my role as caregiver, in my role as patient, in my role as my care friends, and in my role with Magic Horizons. I mean, there's just so much that's converging, and that's why we're here today to talk about this. And for people watching, keep in mind, this is at a high level we're getting into this. We could dive into each of these topics to such great depth. And you're welcome to contact Laura anytime if you want to get into it more, and if you need any help with whatever you're doing. Let's talk about where AI is being adopted, applied now. And we know it differs from health system to health system. But let's talk about consumers. And this is a topic that comes up all the time, and I'm always talking about with people. And I love how you've referred to it as Dr. Internet, and how that's being replaced.
Yeah. Dr. Internet, of course, everybody knows that when you want to get some medical information, the first place you go is Google, and you look things up. Well, Google now has an AI assistant, as everybody knows, and you get some information. So OpenAI has just been unveiling something they call OpenAI Health, and in parallel to that, and that's for healthcare systems. OpenAI is one of the major AI companies, in case everyone doesn't know. And then their product ChatGPT is being extended into something called ChatGPT Health, which will require a special subscription and so forth. But in unveiling that, they said that more than 230 million people each week consult ChatGPT for health information. So sit with that for a minute.
Wow.
So this is already happening with ChatGPT. So that's why I was starting to think, well, maybe Dr. Internet is being replaced with something more personalized, more oriented around health. So if everybody's already going to ChatGPT Health, or many people are already going there, what are we going to do about that? So digging into that a little bit more, OpenAI is not the only company that's recognizing this as a business opportunity and a way to make an impact on healthcare in a positive sense. So I learned just last week about a company called Lotus Health. And Lotus Health has gotten a license to practice medicine as an AI chatbot in 50 states, in all 50 states, with HIPAA compliant systems, using AI. And they do have board certified doctors and all of that, but AI is on the front end and, basically initiating the care and talking with the patient and starting everything. It is a completely different model. I don't know the ins and outs of how the reimbursements work and things like that. But the point that a startup company is putting itself out there as an AI doctor that will replace your first consultation with your doctor is, astounding. And then you also have ChatGPT Health, which we don't know exactly what that's going to look like. But when you talk about consumers and how we are going to get our healthcare, maybe it's already changing, right? Now, all of these systems are going to, ChatGPT and OpenAI also had many, many doctors who've been working for years, actually, to curate and improve the output of these consultations and to make them safe. So there's a lot of work going into that. And we need it because otherwise these things could be dangerous. So I think that's a phenomenon thing. Another kind of statistic. There was a report by this group called Arise. They're doing yearly research driven at UCSF about AI and how it's being adopted. There are now 1,200 FDA cleared AI tools, 1,200, and 350,000 plus consumer apps that have generated $70 billion in the market.
Just in healthcare?
Yes.
Wow.
With AI.
Wow.
So again, consumers and probably healthcare providers as well are using AI in a major, major way, much more than many of us probably realized. So that's really important to know. And then I mentioned earlier, if I can go on to smart glasses.
Absolutely.
My favorite topic.
Please do. Yes.
I just think, they're becoming more and more popular. You can see there was a Super Bowl ad for Meta, Oakley glasses, I believe it was. And so those are becoming quite popular. And there are other large companies, Google, Amazon, et cetera, that are coming out with smart glasses. So it's probably going to be something that's, supplanting or replacing your mobile phone over time. But for consumers, this can also be a way to get health information delivered straight to your ears, straight to your eyes. And for this audience, I think it's important to know smart glasses are quickly becoming assistive devices. So for example, they can be used for people with hearing loss. They can help narrate the environment around you. They've been known, there are applications to help people go shopping. There is a live assist thing built into that Meta created on a volunteer basis. They have squads of volunteers. If you ask for Be My Eyes for people with low vision, you can get a live person watching the camera feed and helping the person, navigate through whatever environment they're in. These have huge implications for people with hearing loss, vision loss, and also dementia. Now there's some, applications there like the yellow brick road if somebody gets lost to help them go back to where they should be. Also geolocation of that person to help find them. Glasses they can fall off, but they're less likely to get lost than your cell phone. Now, a lot of smart glasses right now require that the phone is on your person, but over time they will become more independent. They won't need the phone, but right now they do. anyway, I think there's just a lot of potential there, some of which is available today.
It's fascinating. Yeah, I might have mentioned offline a while back. I was at an event, a party, a post-event party, uh, a year ago, and one of my colleagues, her partner works for Meta and works on the glasses, and I got to try them, and it was fascinating. Just and listen to what they, as much as he could share about what they're working on. Really fascinating, just to your point. So I would encourage everybody to really stay tuned in that and do some research, learn more about what's coming. In terms of patient care, where does AI come in to play in terms of medication adherence? Because that's a big, big issue for caregivers and their loved ones.
Yeah, medication adherence is huge, and it's one of those areas where the patient's behavior can truly affect the outcome, right, of their wellness. Now, sometimes medication adherence is hard because of the cost or convenience or other things, but how the patient takes the medicine, how often and when is super, super important. So AI is already showing up in specialized apps for medication adherence. And the most obvious thing are intelligent reminders. So the way that everybody carries out their lives and when you're able to go, get your refills or take your medicine is different in everybody's lives. And one of the things that AI can do is just notice your rhythms, like when you do certain things. So there's a pattern that you're supposed to take it after dinner, but you forget. Maybe that's when the reminder needs to hit, right? So it's noticing and helping with those patterns. Another one is noticing when those missed doses occur, and so that those can be flagged and you can change your behavior accordingly, or your caregiver can, right? Drug interaction and safety is another thing. That's not as much about adherence, but when you're given a new prescription, my favorite example is dentist versus doctor. Dentist is supposed to know your medical history, but they may not. Or a specialist might, prescribe something, or they may not know all the herbal supplements you're taking, right? So that is an area where if you're able to tell the AI visually what all you're taking, then the flags can go up in terms of these things are incompatible or warnings. And then the integration with your smart glasses too, that can help when you are watches. That can also help it be there 24/7. And last but not least, having a chat bot that you can talk to about, I'm having this symptom. Could it be my medication? Could it be, or I took too much? What should I do? Those kinds of things.
Yeah, that topic is very extensive. Like all of we're talking about is very extensive.
Right. Right.
We could go so deep into all of those, and certainly the medication. To your point about, you mentioned herbal supplements. Often people, and I say this is more often than not, much more often, just from my conversations over years, people who go in and they're sharing what medications they're on, they tend to not share their herbal supplements. They tend to not share the vitamins. They're only thinking of what's been prescribed and what they're getting from a pharmacy. And what they don't realize is the doctors need to understand that, because that can have a significant impact on what they are prescribing and what should be taken. So yeah, thank you for sharing that. I know we talked about this as we've been going so far, but doctors and nurses, we talked about, describe the note taking that comes in there. But how about like some of the other areas under that category of doctors and nurses?
Yeah. Yeah, I think so the scribes, by the way, also can help with the research side of things. So you're getting a lot more information than you would from the clinician remembering what was said. Now, not all of it is relevant. I mean, there might be a side job discussion about, your son's new job, or, things like that, or something sad that happened might not have any relevance, but there's a lot more information coming in that can go into research. But aside from that, the same kinds of LLM, AI. We haven't gone over kinds of AI, but that can help with summaries of the patient's history. So when especially an older person or someone who's had a lot of problems, medical problems in their life, your medical record may be 300 pages long, and the physician probably remembers some of it, but how can they remember all of it? And so the AI can provide a quick summary of the things, especially with regard to the current complaint. So a summary in general and things that might be related to the current complaint before the doctor or nurse, whatever, walks into the office. So that can be a huge help. Another one is, I don't know if this will be put into practice, but there's been quite a lot of research to show that if you asked ChatGPT or some of the other chatbots how a clinician should respond to a specific complaint, let's say the patient has a complex problem that they're having. If you measure the clinician's response versus an AI's response, if it's being asked to be empathetic, the AI scores higher in empathy than the clinician.
Why?
Almost like 80% of the time or more.
Wow.
There's been multiple studies, but I just read an NIH study that was saying that people, if they know AI versus clinician, they're still going to choose talking to a human, because empathy doesn't really help if it's not delivered by a human, right? So we're still going to want to talk to human doctors for sure. That's really important, but that just tells you a shifting role, perhaps, and the role of empathy, right? Maybe we'll see.
We'll see, right?
We'll see. Diagnostics is another area where we're not at the point where AI will do diagnosis of radiology, for example, mammograms or lung X-rays alone. However, it really can help. Again, finding those patterns that the human may not notice. So there's been research showing that diagnostics that are supported by AI are better with fewer false positives than by humans alone. So that's important. Research assistant. Okay, when we talk about rare diseases, when we talk about even common symptoms, but you don't know which of the 20 things it might be, it is a research assistant that can go search the literature and bring back what's relevant right now. Also, what are the latest drugs and treatments? This kind of research assistant the doctor can really use. So that's another role for AI. And there's also they're going to be the OpenAI Health product for, and probably many competing products for the doctors that they can use when they're planning and so forth. So that's some examples.
Yeah, I want to give an example of what I've experienced recently. I use ChatGPT, and I use it to help because there's a lot of information that comes in. This is specific to a lot of things, but in this case, I'm talking about, for instance, my mom. There was a medication that she was taken off of, and then because it can cause macular degeneration. It's called plaquenil. And she was taken off of it, and it was agreed to by all of her physicians. 6 weeks later, she ended up in the hospital because that was one of the drugs with her autoimmune disease that was helping her protection, helping her immune system. And she ended up, but not just that. What happens is it was something she was on for 7 years. You're now changing the way the body's working. It became accustomed as working. So true, you've got to be concerned about one thing, which is your eyesight. But if you do that, it also could be the rest of your body and the rest of your system. And so what ended up happening, she ended up in the hospital. And long and short of it is, I was using ChatGPT to see if I was correct and online, in line with what I thought my theory, and it was very encouraging. And so I was able to bring back a lot more information than I can share right here and present this to the physicians. And my instinct was correct, and that it was. And she's been back on that now, and she's feeling a lot better. So just interesting. I would say, as a caregiver and advocate for my mom, speaking to everybody out here, don't hesitate to look at things, but don't think it's the only thing. Make sure you're using that and corroborating that with the physicians that you're working with.
I think that's super important right now because, as we're going to discuss, AI still has a lot of flaws and it can give you false information. We all know that. You're hearing that on the news. It's really true. So corroborating this with your physician is super important.
Absolutely. So before we get more into that, let's talk about the administrative side, back office workflow automation and so forth. There's, when we think of that and what we're saying to our audience is we're talking about insurance claims and benefits and payments, and we all deal with that in some way. Can you speak to that?
I can, and I here's where I think time will tell how this affects consumers, but certainly just the idea of making insurance claims more accurate and more efficient, you can see how there would be monetary savings and time savings from that. I mean, waiting for an insurance company to decide whether something is covered or not, that can take 2, 3, 4 weeks.
Oh, yeah.
And that is really, really critical to a patient. So I don't know of any specific examples where they're trying to shorten that time, but that would be a benefit I would be hoping for. The other kinds of things that they're doing, and by the way, I think they go for things that are kind of easy to do with the AI as it's currently packaged. And a deeper analysis might show that there are other things that people would prefer you to do. So I think that's why doing patient research and finding out what people really want is important in the development of these things. I would like them to shorten that, approval time. But what they're all also doing are things like using AI to do automated calls. I'm not sure I love this, but rather than having, somebody calling, hello, you have an appointment at 3 o'clock on Monday, having an AI do that makes some sense. Or even more meaningfully, calling up the patient and saying, hey, we would like to interview, we'd like to ask you these 5 questions. Now we do a lot of this online in forms. Will it be better if perhaps they're asking the question with natural language and recording the answer? Maybe that's a better and more human way to do it, even though it's an AI involved. So those kinds of applications are also being experimented with. And that, the human that was doing that presumably now can do something else. Remember, one of our big problems is we've been adding more and more people to service each healthcare condition and case. So, yeah, I'll just stop there.
No, that's excellent insight. And again, another topic we could just go really deep into. So let's move on to the next topic, which this is sort of I'll call it the buyer beware kind of section. Let's talk about behind the screens, as you put it. What can go wrong? Because just as much as we're learning and we're helping viewers understand all the wonderful things that it can be, but there's also things that can go wrong. So let's start out with the types of AI.
Yeah, I think there's many different ways to talk about all the different kinds of AI that are going on. AI started to be developed in the 1950s, so it's been around for a while. And the stuff that I was working on is now called GoFi, good old-fashioned AI. Back in the 80s, right? That was symbolic. It was driven by engineers like me. But now a lot of things are more automated. So I'm going to describe just a few things. One is called machine learning. And that's a kind of a branch of AI that enables really a computer to learn from data. And the data can be, books, it can be sentences, it can be internet data, it can be electronic health records, it can be motion data, it can be images, it can be videos. And it's been applied to all of those things. And machine learning really, really took off after 2010. And it started to change the nature of creating any kind of program at all, because the machine can learn things and programmers don't have to sit there and code it and create a database to support that. So that's kind of step one. Another step is something called discriminative AI that you don't hear people talk about a lot, but its job is to discriminate and classify. So this belongs in this category and that category, or these are all a set of books of this type and genre and so forth. That has been a very human activity, this is a butterfly, this is a moth, that kind of thing. So that kind of discrimination. Then we often hear about generative AI. So generative AI goes a step beyond the learning and beyond the discrimination to create new things. That's what the generative means. So it understands, what these things are. It understands you now want a picture, of a dog on a bicycle. Okay, it knows what a dog is, knows what a bicycle is, can create the totally new image that's never been created before, right? From its vast knowledge of these things. And LLMs, we hear that a lot, large language models. Those are really, there were breakthroughs that started to create those in 2017, and they really took off with ChatGPT in 2022. And those are really about natural language. And part of the magic is that they encode the language with kind of numerical tokens, and it allows the machine to process it much more efficiently. Although it's efficient, but it also requires massive data centers. We keep hearing about that. All of these AI applications do, because they process massive amounts of data. But that's what the large language model is referring to, and it's looking at the entire internet, everything that's been written on the internet, right? Books, papers, and you've heard on the press, of course, about disputes about, does it have the right to ingest the entire New York Times, or is that copyrighted material? So there have been all kinds of intellectual property disputes that have really just begun in terms of it ingesting all this data. A little side note about electronic health records. Electronic health records have been collecting health data for 15 years. And the research around that has been greatly, enabled. However, with AI, it's further enabled. So I think AI is converting more of that EHR data into actionable research over time. So those are different kinds of AIs. There are many ways to describe it. That's about as technical as I think we need to get here to begin to talk about what can go wrong.
Yeah, true. Again, we could delve into each of those topics for an hour.
Right.
Or more. How about guardrails? I think when we look at guardrails, we can think of policies and procedures. So, we think of companies and we think of healthcare. Let's just talk about healthcare companies. So hospitals, there are different guardrails in terms of policies and procedures and protocols that they go through. How does guardrails for privacy and security work with AI?
Yeah. So really the guardrails are around the data for the most part, and where it goes and where it's stored. So in any healthcare system, they're complying with HIPAA regulations, and then there are additional regulations around personal information, financial information, if there are payments involved and that sort of thing. And I think those are very well built, but there's certain principles around them. By locking up that information and protecting it, your private information, it also can create inconvenience. So that is why it's a combination of those guardrails and the policies around them that makes it sometimes hard for a caregiver to help somebody. You call in, well, who are you? Well, I'm so-and-so's daughter. Well, I don't know you. I don't have your information, right? So that's a simple example. But convenience can be the enemy of compliance, and vice versa in terms of those guardrails. But we need them. We need our information to be protected. We need to know where our information is going. And I think one of the things that we want folks to watch out for is when there's a new technology, those guardrails can be broken in novel ways that maybe we didn't anticipate, right? So that whole idea about AI, looking at the entire internet and sucking up intellectual property. I guess people just didn't think about it. It's broken in a way that we didn't think about. And the same can be happening with privacy and security. So when these new things come out like ChatGPT Health and so forth, They are certainly thinking about that, but maybe the less famous or the new startup, they may or may not be thinking about that. So you as a consumer need to be thinking about, where am I putting my data? When I ask an AI to take over my computer, like Claude it's one of the new things that's going on. Some people are giving them free access to their passwords, to their credit cards, so they can act as agents for that person. Um, some folks are willing to do that. I am not. And I think I think as a caregiver, you need to be more conservative for the person you're caring for than you would even about yourself. So those are some of the things, that can go wrong. I also give you another example, my, smart glasses. Well, we've already had instances. I was reading a nurse leadership blog where they're saying about those Meta glasses. Well, the nurses are showing up with those on. The patients are showing up with those on. And, they have cameras. So are they recording what's going on? Now, there is a little blinking light that goes on, but it's very subtle and it can be overridden with a cheap thing you can buy. So, the hospitals and doctors' offices are going to have to think about policies. Again, breaking the guardrails in a novel way that nobody really thought about, right? People aren't intentionally doing bad things necessarily at the beginning, but those things can happen. There can be breaches. And I also do think we need to go back to also the different kinds of AI and how they can fail or give us wrong answers. Do you want to
Yeah,
go back?
let's circle back to that. Thank you.
Okay. So all that data that we use for training AI is from the internet and corporate databases. But there can be some things wrong with that data. If you think about it for just a minute, there can be bad data in there, incorrect data. There could be some, let's say, influencers who are advocates of certain commercial products. That might be part of the data set if you're looking at, supplements or what you do, right? Or nutrition information. I mean, I would hope that the healthcare oriented AIs don't have that, but your general purpose, chat GPT online may have some bad information in it. So you have to keep that in mind. Also, the people who chose the data sets at the healthcare company or the engineers, they may have biases. They might say, well, I only need to worry about, just to be ridiculous, let's say people under 30. I don't need to worry about the rest of them, right? They wouldn't say that, but I'm just illustrating a bias that could occur. And there can be gender, race, ethics, I'm sorry, eth
Ethnicities.
Thank you. But also incomplete data. And I often think about, for underserved populations in medicine, we may not even have data about them because they're underserved. So their data is not in the system, right? So those are things to think about with data. We've all also heard about AI hallucinations. We've touched upon how the AI is looking at patterns. And when it's generating something new, generative AI, it may need to fit the pattern, but may not have the right information to fit into it. So it gives you something completely, utterly, preposterously false. And the problem is in medicine, you may not know that that's preposterous, right? So that's something to watch out for. There's also a word that sycophancy. I can't necessarily pronounce that one either, but it really has to do with the AI wants to please you. And it may give you incorrect or shaded information that's a little more positive or whatever because it wants to please you. There's also in medicine, in the research is showing AI being overconfident. Yes, this is the diagnosis. There is no other possible diagnosis. I have the right information. So there's also narrowness of thinking. A lot of AI has been very task oriented to date. So I have completed the task. I've given you the information. Well, what about these other possibilities? It has to be prompted to think further. So there can be a narrowing of thought that happens. Again, it's also based upon past thought, right? So, and I could go on, but I do also want to I just want to add one more, which is over trust, and that's on the user's part. So we users need to not over trust the data. Perhaps in 10 years, it'll be more reliable than any human. But right now, you really, you really need to be careful. And with medical information, validate it with a physician or with other, sources of knowledge that you trust.
Yeah, absolutely. Using it as a tool, as a guide,
Right.
as an assistant. And just like nobody's perfect, certainly AI is not perfect. And so, but we can use it as a guide to be helpful, to ask thoughtful questions that we may not think of in certain circumstances of a physician, of a healthcare professional.
There's one more issue I wanted to address
Yeah, sure.
before we move on. I think this is really, really important because AI also is one of the big fears is that it will replace human workers. And I think that kind of fear is probably going to be there with medical coders, radiology techs, nurses, even caregivers. Um, so I think that is something that the system needs to think about. But we also have to remember the macro problem that we're paying, the costs are rising so fast because we keep adding more and more people to things. So I think what we want to think about in an overview is how can we free the med tech up to do something else or to do more? How can all of these people do 10 times more with the help of these assistants so that our system can handle more people with better quality care at a lower cost? That's really the goal. So I'm not saying there's no danger of human job displacement, and it is a concern. We have to watch for it, but we also should look at it in a more positive light in healthcare.
I agree. And I love that energy. And we're going to take that into our last topic,
Okay.
which is future possibilities. Uh, and we've outlined 4 different areas. So why don't we just start with the first one, which is personal agents and what that means, what that might look like.
Yeah. So this is an idea of having an agent that's representing you or representing a patient or representing a consumer in getting things that they need. And we initially think of it as, oh, I've got an agent working for me. Maybe that agent in healthcare is arranging for my care. Maybe there's a care plan. And so it knows to make an appointment, to follow up on the appointment, to make sure the prescription after the appointment is filled. Those sort of workflow things, which right now can't happen because all the computer stuff is so task oriented. I've done my task, my form is filled out, it's submitted, we're done. Now we wait for someone else to do something. But what if the agent was there and saying, oh no, the whole cycle for this interaction is from appointment to follow-up to second follow-up, and it's acting on your behalf rather than waiting for the doctor's office to do that, right? So arranging for care. And then you also, if someone arrives in a new situation, perhaps they're going into some kind of long-term care. For heaven's sakes, why isn't there a checklist and an AI agent to help you go through that checklist? So you don't have to depend on just self-discovery of all the things that you're going to need. And another way that a personal agent can help is monitoring a chronic condition. So that might be hypertension, diabetes, and so forth. And there's many different ways to do that today. But what if there's kind of a holistic thing that you have on your phone that isn't also demanding your attention all the time? Maybe it's combined with a sensor that you're wearing or kind of just deriving from your lifestyle. Oh, this person, they're taking their readings, they're doing okay. And that's okay. It's just kind of monitoring the condition and then raising flags when maybe you should go to contact the doctor. A lot of people talk about getting telemetry data about health and sending it to the doctor. Well, another way to do it is send it to the patient and have them go, hey, my thing told me I have a problem. Maybe I better talk to you right now. Oops, Lord, raise my hand.
It's okay. We can raise our hands.
I think those, and one more thing to think about to inspire your imagination. You might have not just 1 or 2 or 3 agents running on your phone. You might have 100, and they might be talking to each other and coordinating to your benefit, right? So that's just that could be a really cool thing. And then those agents might be talking with the doctor's agents and taking care of things for you in the background. So again, we're looking at perhaps a streamlined and more empowered patient.
Yes, absolutely. It's fascinating. It truly is. And I love the chronic conditions example because the millions of people who deal with chronic conditions just here in the U.S., let alone around the world, and how helpful that can be. When we talk about personalization of care, you and I have talked about patient education side, and I know you'll talk about it now a little bit more. But as an example, let's talk about targeted cancer treatments. And I'd love to hear more about that.
Yeah, the trend towards personalized care in cancer has been going on really for decades, but it's also very much based upon data and research data. And as with these other areas we've talked about, going from kind of algorithmic analysis of data to machine learning into more expansive pattern matching in the data can help to find treatments for cancer that might not have been thought of through more traditional means. And not only can they be thought of, I mean, there are AI programs now that will, try and then do a simulation test of, 1,000 different treatments with different chemicals applied to a protein, and doing that all in a simulation before, saying, okay, here are the five best possibilities of a potential drug that's going to deal with this aspect of the cancer, right? So there's that. But there's also the idea that we can gather data on more and more people who've experienced cancer and feed that into the algorithms. And then incorporating a person's genome and a person's health data together and matching that with the best cancer treatment. That's the truly personalized aspect of it.
Yeah, absolutely. And we talk about patient education. Um, we have talked about house call VR. Uh, and
Yeah.
you and I both know Linda, who started House Call VR. How does that apply to that?
Well, I think there's, that's House Call VR is an immersive solution to how to provide the patient education. Again, if we look at the cures or dealing with chronic conditions, a lot of it has to do with how the patient understands things and how they behave. And that would be in managing chronic conditions, dealing with discharge instructions, even just maintaining your health, how well you understand things. So patient education has a huge role to play and is often really under, underfunded, to be honest. You get a little pamphlet from the hospital when you leave, or at least we've gotten past mimeographs, but we get a PDF now. But think of it if you have an interactive session that helps you really understand, what's going on in your brain or what's going on in your pancreas, which is what Healthscout VR, their demo does, or different parts of your body. When you do something that you shouldn't do, or when you do something that you should do, what does that really do to you? And how does it help you? And how can you modify your behavior to help your own health? So I think that's a combination of visualization and simulation, which is what virtual reality and to some extent augmented reality on your phone or on glasses can give you, combined with AI that can help to create the scenarios and also to personalize this to you.
Yeah, that's an excellent point. We're cutting close to the end here, so this is great. It's been a great conversation. Two topics I want to finish with. One we've called home-centered care, and there's three topics under that, which are pretty fascinating. And I'll just mention them, and then you can go into them. One is sensors plus AI, and how that's used in hospital, related to hospitals. Then we have home robots, which is fascinating. And then, of course, everybody knows of self-driving cars, but how about self-driving wheelchairs?
Yeah, yeah, exactly. So yeah, the sensors in AI. if you're discharged from hospital and are given, and again, some of this, a lot of what we're talking about is already happening today, but it's the ability to really make it work seamlessly is multiplied by the application of AI. So discharging somebody with some remote monitoring equipment after, say, a heart procedure, let's just give that example. If there is also AI to help interpret that data so that you're not just getting these mechanical false alarms and all, or the data gets disconnected and it gives you an alarm for that. So I think the addition and also the AI understanding things about your circumstances and your personal health, it can help maybe discharge people sooner without the bad effects of potentially getting them readmitted too soon. So being able to raise those alerts if they're not taking proper care of themselves, if they're not, getting the medication, not getting their food, etc. And then the sensors can help to monitor actual vitals while that's going on.
Fascinating. So where are we? What do we have left here? I think we have one topic.
Yeah, well, we didn't talk much about robots. So another big tech trend is going to be robots. I realize that not many people are going to be buying them soon, but that is one area where AI is a lot of investment is going into that. And the idea of robots, especially for seniors, has been researched for 20 years. And so I expect we will see some new products in that area soon. Yes, and self-driving wheelchairs as well as cars for mobility is going to be helpful.
All right, so we'll bring this home with a general topic that applies to everybody, whether you're a caregiver or not, is general health and well-being. And how does AI play into validating health and nutrition advice?
Yeah, I think when we talk about overall healthcare, staying healthy is the best kind of healthcare. We all know that. But there's a lot of misinformation out there, and there's just lack of information. A lot of people just don't have degrees in nutrition, or they are not educated necessarily in all the ins and outs of physical exercise and all that sort of thing. So just like we're going to have things like ChatGPT, won't there also be some things that really can give you validated advice about health and nutrition, but that is personalized to you. So that's the thing. Once we can pair this with personal information, we all know that people have different diets. So one person may have a kosher diet. Another person may be a vegan. Well, the advice that they want and need is different from each other. So I think just those types of things would really help people to enact their own health program and support their own well-being.
Excellent. Well, we've spent a lot of time today, and there's been some great information shared, and I hope that the audience feels that way. I know there's things I'm going to take away that I'm going to research, so hopefully the audience feels that way too. And thank you so much for spending the time. And I want to say to everybody out there, if you're interested in learning more about Laura's work, connect with her on LinkedIn. Check out IterationZero, where she is the founder and principal consultant. And yeah, and stay tuned for future episodes of our XR and AI in healthcare, sponsored by Magic Horizons, and all of our other series. So thank you so much, Laura. We really appreciate your time.
Thank you for the opportunity. This was a fun conversation.
It was. Take good care.
Thank you too.